Now help me welcome Ruchi Guerra, who will now be speaking for the dentistry profession.
Good morning, everyone. So, you are an internationally trained dentist and you're looking to move to Canada. We have two options for you. You could be coming from a country which has a program that is not accredited with Canada, or you could be coming from a country where the program is accredited with Canada. So, I'll start off with the non accredited program that is usually any country other than Ireland, US, New Zealand, or Australia. All right. So if you're coming from anywhere, any other part of the world, you are able to come to Canada. You're able to give exams and become a licensed dentist over here. When you go through the non accredited pathway, you do not need to have a PR. You could be just somebody who says, I'd like to give Canada a try. I'd like to see how it is to be a dentist over there. I am a dentist from my own home country. Let me see how I can reach Canada. So there are two ways when you come in from a country which is non-accredited with our country, with Canada. You have the NDEB equivalency process, or you have the option of doing a bridging or a degree completion course. The first option, that is the NDEB, the National Dental Examining Board of Canada, this is the most common pathway. There are four main exams, or rather, I would say there are three main exams that you need to take for this particular pathway, right? First thing you're going to do is you're going to reach out to NDEB. You're going to reach out for an equivalency. So let me give you a scenario. For example, in my case, let's say I am coming from a country which is which gave me a BDS, a Bachelor in Dental Surgery, as well as an MDS, a Master's in Dental Surgery. And now I'm trying to figure out how to be a dentist in Canada. So I reach out to NDEB, okay, online. I can send them, depending on the country you're from, you will be asked for a few documents. Like, for example, they might say, let's see a degree that you have qualifications in your country to be a dentist. They could ask me for some kind of a good standing certificate, which means if I am with a particular dental council, I have a good standing with them. My transcripts, where did I do school? Where are my transcripts? My proof of identity, if let's say I had some kind of a change of name along the way. Okay? Now, to be able to, once I reach out to NDEB, they say, okay, you know what, you're good to go. Your degrees are all taken care of. Now you can start the examination process. The first step that I'm going to be doing is called the AFK. That's the assessment of fundamental knowledge. The second step is ACJ, that is assessment of clinical judgment. And third step is going to be NDECC, which is a two-part exam. It's got the clinical skills as well as a situational judgment in it. First one, AFK. AFK is a theory exam. It has to do primarily with your basic dental sciences. It's a 4-hour exam, 200 MCQs, and the passing mark is 75 out of 100. Now, the good news is that every single question that you answer, you get, and you answer correctly, you get 1 mark for it. Thankfully, there is no negative marking. If you do get a question wrong, you just get a 0 for it. So attempt every single question. Um, for this particular exam, the AFK, you can give it a maximum of 3 times. You have to clear the exam in these 3 attempts to be able to move on to the next step. It's conducted by Prometric. It's an online exam. You have centers that you can sign up to and reach to give your exam on that day. It's held twice a year, February, as well as the next one is going to be in August. So let's say it is right now 2026, May. If I decide to start this process, my first step now would be to reach out to NDB and give them all my documents so that I can get my equivalency. Because once I get my equivalency, I am ready to apply for this particular exam. It usually opens up 2 to 3 months earlier. So let's say the exam is in February. Ideally, by October this year, I should have everything ready so that I can go ahead. When it opens up the portal, I can sign up to give the exam. The next step, once I clear my AFK, so I've cleared my AFK and now I have the next step, that is my ACJ. That's an assessment of your clinical judgment. This is a 5.5-hour exam. We have about 150 MCQs. In this, it's more of a case-based scenario or an exam. We have diagnosis, treatment planning, clinical decision making, as well as radiographic interpretation. So you will be given different case scenarios, there'll be radiographs, and you are going to be answering questions pertaining to those particular situations. Again, the passing mark over here is again 75 out of 100, 75 or greater, and you are good to move to the next step in this particular process. You have maximum of 3 attempts. Again, you have to clear in these 3 attempts at best. It's conducted by Prometric. Again, it's an online exam. It's taken twice a year, May and in November. So typically somebody who wrote the AFK in February, let's say the first exam, by the time you get your results, it's going to be at least 8 to 10 weeks, which means that you may not be able to apply for the exam in May itself. Even if you clear your part one, your AFK, you will, by the time you're able to sign into the portal with your results and say, I can now give my next exam, it's going to be, you can aim for November in the same year. The third exam, NDCC, this is a 2-day exam. We have our situational judgment as well as clinical skills. This is supposed to be the hardest exam. It does happen over 2 days. Typically, your situational judgment takes about half a day, whereas your clinical skills may take up to 1 day. So they will always advise that, and this particular exam, it happens in Ottawa, so they will always advise that prepare to be in the city, in the town for at least 2 days. What happens in a situational judgment? We have 10 stations, 5 written, 5 interaction. The focus areas are things like patient-centered care, professionalism, communication and collaboration, practice management, and health promotion. These are the 5 main things that they are going to be assessing us over. The next is your clinical skills. The clinical skills is done on a mannequin. You are expected to do a few procedures like a class 2 amalgam preparation, a class 2 amalgam restoration, composite restoration, a class 4 composite restoration, an endodontic access on a tooth, crown preparation, and then a provisional crown. So the crown preparation that you did on the mannequin, you are going to be provisionally preparing a crown on that tooth. And finally, infection control and safety. This particular exam, the clinical skills, you have to pass all to be able to clear and move on to the next step. No critical errors are allowed in this exam. This exam is a very hard exam. Situational judgment, you should have passed at least 6 out of the 10 scenarios that you have gone through. This exam is held throughout the year. So you've done with your AFK, you're done with your ACJ. Once you clear your ACJ, you can take as many attempts as you need to, but they have to be completed, that you need to finish your NDCC within the next 5 years. Okay, this exam, like I already mentioned, happens in Ottawa, so that is something that you need to travel to be able to give this exam. Now, the most important thing, everyone's wondering the cost. What does it look like? Yes, and that is something, yep. So when you apply, your application initially is going to be $900, AFK is going to be $1,000, ACJ is going to be $1,350, and NDCC is going to be $6,500. This is just the fee that you are giving to the governing bodies to be able to give the exam. When I look at these numbers, I feel it can work in either way. I can say, okay, this exam is really expensive, so I better get it through my first shot itself, right? I know the other way of looking at it is feeling the stress of the fact that, oh my God, it's so expensive. What if I don't do it well? Then what does it mean? I'll prefer not to be that person. I'll just prefer to focus on that I'm going to clear it the first time because, yes, there is a fee associated. The good thing is that when you do come into Canada as an internationally trained dentist, you do have support groups like we spoke about in the morning. I was aware of the one that we mentioned in the morning, yeah. So that was really good to know that there are more than one bodies that are there to help out internationally trained dentists if they want to take their journey ahead in Canada. So the first one I wanted to mention about, this is more of a micro lending. It's called Windmill Loan, and I'm sure there are many more out there, but this particular one, when you come in and you say, okay, you know what, I am a dentist from another country and I'm looking to be a dentist over here, they will give you a loan of up to $15,000. They will go through your credentials. Of course, it varies case to case, but up to $15,000 they may be able to loan you, and this is something that you can use towards your exams. I'm not going to be able to say that with this, you're taken care of with your exams, preparation, everything. No, absolutely not. This is something you can keep aside for your exam fees. This is one option. Private banks in Canada are very happy to give you a line of credit, which, of course, please keep in mind that it comes with an interest rate. It is not something that you just get the money, but I always feel that if a bank is willing to give me money, then they see something in that. So, dentistry is a profession where they know that eventually you will clear your exams, and when you do, they don't have to worry about this money, it will come back to them. So, in the private bank, if you are doing the licensing process where you say, okay, I'm going to do the AFK, ACJ, as well as the NDECC, what they do is private banks, if they decide to give you, they can give you a line of credit up to $100,000, but they give it to you in parts. What that means is once I have my NDEB equivalency or my acceptance that, okay, go ahead and give your exams, they'll give me a certain amount of money. Once I clear my AFK, I give them my results, then again, they share a little bit more. So it's not like you get the line of credit of 100K right away. You are released funds slowly in this. Um, Reality check. It is an extremely hard exam. I think everyone in this room probably knows a dentist who is either preparing or knows somebody who is wanting to give these exams. The pass rate is quite low. It's extremely competitive. Multiple attempts are extremely common, and you do need to have an extremely strong preparation. So I feel that when you are coming into a whole new country, the way things happen are just so different. It takes time to get settled in, to understand things. But this is an exam where I feel when you decide to give it, you have to give it your 100%. Especially, I feel if you are going the path of AFK, ACJ, and NDCC. So, tips for success in this exam: start your preparation soon, give it enough time. AFK is the first exam, that is the gateway. Take about 6 to 8 to 10 months of preparation before you decide to give that exam. Don't rush getting into it. Because the first step, when it goes well, I think personally we feel more motivated. We feel, yes, I can do this. So that's not an exam you want to rush. It's a gateway exam, it's a very important exam. Prepare well for it, take your time, and then give this exam. Study groups, there are quite a few study groups that exist which you can be a part of. There are different preparation programs. There is prep doctors, there is confidentist. These are, they have been working for years together with internationally trained dentists to train them how to give these exams. They have been, every year students pass out, every year dentists pass out who are able to learn from them and then give their exams. Again, this is something which comes at cost, which we will discuss shortly. But yes, a study group is very important, or being able to be a part of a program is very important. Canadian dental exposure, irrespective of where you come from, the way dentistry works in Canada is going to be very different from your home country. Um, when you come in, try and gain that clinical exposure. In a typical setup of a dental office in Canada, you have a front desk. You could work as a dental receptionist. You could work as a dental assistant with the dentist. You could do either of these jobs to gain some kind of a Canadian exposure, which tells you this is how dentistry works over here. It's again different from any other country that we may be coming from in terms of communication with the patients, in terms of how the sterilization runs, how the office runs is different. Communication skills. I think that is something that all of us can use at any age, irrespective of how much experience we have, to be able to communicate, to be able to understand and resonate with the people who are in front of us. Once you are done with your AFK, your ACJ, and your NDECC, the next step is going to be your virtual OSCE. This is going to be the final exam that you write. Again, it's a computer-based exam, 200 MCQs. It takes place twice a year in May and in November. The passing is 75 out of 100. You need to have 75 marks to be able to clear this exam. The registration fee is $459 and the exam fee is $1,750. Yes. So the OSCE is going to be more of a structured clinical exam. You're going to have real life scenarios. You're going to be asked more case based questions that you might be facing. Okay. So the NDEB certification happens once you have cleared your ski as well. I do want you to know that the pass percentage, the number of dentists who are able to clear this exam in one attempt, that is the AFK, the ACJ, as well as the NDEC, is only 28%. Of all the dentists, of all the international dentists who apply to be a dentist in Canada, in one attempt, they're able to clear all the exams, and that is only about 28% of the people. So most people do end up attempting each exam more than once. The Canadian trained dentist a lot higher, because when you are a Canadian trained dentist, what happens is that you've done dental school over here. You just have to clear the final exam, that is the OSCE. That's the only step that you. Oh no, they don't do the AFK, ACJ. No, that is only for the internationally trained dentists who are wanting to be dentists in Canada. But if you are doing dental school in Canada and you are done doing that, the final step for you to be able to certify and work as a dentist, you do have to take the OSCE. And OSCE is usually, the pass rate is, if I'm not wrong, 85 to 90%. It's not an exam that people usually they're able to clear it. Yeah. I think if you've reached that particular step, you're pretty much set to start working as a dentist. And once you clear your OSCE, then the next step is to get in touch with your regulatory body in your province and then apply for your certification. So, for example, in Ontario, it's called the Royal College of Dental Surgeons of Ontario. Now, this is the next step, or rather the alternative step. You've come to Canada, you find out, okay, either I can do the equivalency process or I could get back to school to be able to work as a dentist in Canada. If you decide to take the university route, you have to write an exam that is called an ADAT. Now, ADAT is different from AFK. I think till a few years ago, you could write the AFK. You could say, okay, I'm going to take the AFK and I can either do the equivalency process after that, or I could go to university. But now the exams have been separated. If you take an ADAT, then that is the route that takes you to university. If you're doing the AFK, then that is the route that takes you towards the equivalency process. So as far as the ADAT is concerned, again, any dental school in Canada, there are about 7 to 8 dental schools that you can apply to as an internationally trained dentist. And the schools are anywhere between 2 to 3 years of a bridging program that you have to be there for. All right. To be able to apply to any Canadian dental school, let's say, for example, if I am a foreign trained dentist and if I decide I would like to go the university route, I am going to first apply for something called the ECE evaluation. So if you go to the ADAT website, ADAT is it's an American-based website. ADAT is given in the US as well as in Canada. So when you do go to their website, you will see something called an ECE evaluation, where basically your course, for example, you might be familiar with the WES evaluation. With ECE, you are going to get like a course by course evaluation done of the degree that you have, and then they will send that to the universities. Now, as far as the ADAT is concerned, that's also known as the Advanced Dental Admission Test. This is something that you need to apply if you want to go to a dental school in Canada. The exam can be taken anywhere between March to August. So let's say today is May of 2026, and I decide, you know what, I want to write my ADAT as soon as is possible. The earliest I can do is going to be next year, March. So meanwhile, what I can do is I can start the process. I get in touch with my university. I find out all the information that I need. I get in touch with ECE. They tell me we need these documents. I have everything moved over to ECE. The evaluation is done. And by October, November this year, I'm prepared that, okay, I am going to be giving my exam next year in March. So as soon as the window opens up, I apply for a date to give the exam. Now, the exam, the price is listed in USD because this is an American-based website where we are doing this. So 465 USD. The score ranges anywhere between 200 to 800. Now, if you do want to apply to a Canadian dental school and do it in a manner that you are able to get a score where you can get through, you need to aim to get a score above 650. That is a competitive score. because there are so many people who are applying, who are writing this exam, that a score of 550, 600 is not going to give you the edge over another person. So the aim is to try and score as high as is possible. This exam, I can write it twice in this cycle. So let's say I wrote the exam in March, I get my results, and I find out that I got, let's say, a 565, and I'm like, no, I can do better, or I want to do better. Then I have to give a break of 45 days between my first exam and the second, and then I write the exam again, right? So let's say if I wrote in March, then again I wrote it in August or July end, I have to give a 45-day gap. If my results come out and I'm still not satisfied, I can again give the exam only next year between March and August. Again, it's a 4.5 hour exam. You have the Pearson View centers where you can take this exam. There are many more centers in the US. For this exam in Canada, we have about 15 centers. We do not have a center in Quebec. So if you are in Quebec and if you're applying, you will have to find the center that's going to be out of. Now, this exam is going to include biomedical sciences, clinical sciences, data research interpretation, and evidence-based dentistry. So someone who's preparing for AFK can write the FK as well as the ADAT, but there are some things in ADAT you need to give more importance to, or rather, you will have to study more, because things like evidence based dentistry was not a part of AFK, that was a basic dental sciences exam. To be able to go the university route, you do need to have a PR or a citizenship. You cannot apply to dental schools to study in Canada. Good news is that they are always looking for cultural diversity, which means that if you are from a country where not many people live in Canada from, then that's definitely something that's going to work in your favor. Once you've given the ADAT, you've gotten a great score, you apply to schools. The next step is going to be the interview and bench test. So let's say you got a fantastic score, you've applied to the school that you're able to in Canada. They will then reach out to you and schedule the next step, which is going to be an interview as well as a bench exam. Now, these are the schools that you can apply to as an internationally trained dentist who does have a PR and has cleared his or her ADAT. University of Saskatchewan, they have about 10 seats. University of Manitoba, Montreal, we have McGill. To be able to apply to the McGill University, you do need to know French. You don't have to be an expert in French, but French is a level B, if I'm not wrong, is something that is important to be able to apply for French, apply for McGill in Montreal. University of Alberta, University of Toronto, Halifax, and then University of Western Ontario. These are the 7 universities that you are able to apply to as someone who is a foreign trained dentist and has cleared their ADAT. Okay, University of Saskatchewan, what I've seen is in the past 10 years, University of Saskatchewan till 2 years ago, they were not even taking international dentists. They've started the program recently. I know they started off with 6. This year it became, or the last year it became 10 seats. Toronto, if I'm not wrong, is about 8 to 14 seats, but I'm not 100% sure about this. I'm sorry, I'm going to have to confirm that. And same for Western Ontario. I'm not sure of the exact number of seats, but I can definitely find out and confirm to you. Oh no, the ADAT is going to be valid. The ADAT is going to be valid. You can give it again the next year. You can apply to different universities, and it's going to be the same score, and that's very much valid. Unless you want to update it or upgrade to a better score, then you can do that. Um, I think it is an exam that's valid definitely for 5 years. Is it going to be something that's more than that? I'm not 100% sure. But 100% you can, for 5 years, that exam is valid. The scores are valid, and you can apply. The cost associated now for your ECE or your evaluation of your degree or credentials, it's $200 US. If you get through school, you're looking at an expenditure of anywhere between $250 to $300,000 in those 2 to 3 years of school. I feel that they have done a great job of streamlining these exams, and I know that they're continuously working on it. Dentistry or the medical field or nursing for that matter, these are very these are extremely certified, and there's a way of doing things. When you come from a foreign country, dentistry in like the country where I grew up was very different from how it is over here. So when I come and see that as a third person, I realize that these exams are actually needed. I know that AFK and ADAT, I wish they could put it together, not separate it, because Now I have to give a separate amount of money for my AFK, separate amount of money for my ADAT. I would have liked that that is something that is, one exam, and then I can choose to either do my equivalency or do my university route. But do I see the wisdom in all that needs to be done to reach where you have to reach in the end? I do see it. Again, we keep hearing from the RCDS, or the Royal College of Dentistry, that they are working on streamlining things, changing things, because there's a huge influx of internationally trained dentists in our country who are wanting to license and who are in the process. So I would like to hope and think that they are working towards it. Yeah. Um, when you do get an acceptance from a dental school, let's say University of Alberta or any other of the ones that were mentioned, you can go to a private bank and they will give you a line of credit of $350,000. So they're saying that we are here to help you out for the next 2 to 3 years. This is a line of credit. You can start using it when you need to. You can use that towards your tuition. You also have something called the OSAP. You can apply for a grant as well as a loan from them. The interest rate on that does not start till a lot later. Um, you can expect, let's say, if my dental school is asking me to pay around $150,000 for my 1 year of education for the first year, you can expect around $40,000 as something, depending on your family income, that you can expect from OSAP for each year of your education. Now, let's say you are coming from a country where you've done an accredited program, which means, like I said, US, Ireland, New Zealand, Australia. In this case, you're going to send in your documents to NDEB. They're going to give you an equivalency, and you can go ahead and take the next step, that is the OSCE. Personal note I can add to this is my husband is a dentist. He did his DDS in the US. And he said when we had to move to Canada, he said OSCE was the hardest exam he has ever given in his life. And he's someone who's always cleared all his exams with like an A grade. And he said, I was genuinely concerned. So I know that if a dentist has cleared the OSCE exam, you can be sure that he's done his part of education and he has worked really hard to get this uh, equivalency or this degree certification. Okay, now as far as the preparation is concerned, there are study groups. I just, no, yes. So you have study groups, but you also have prep programs. You have prep doctors is one of the most, I'm not from prep doctors or in association with them in any way, but I keep hearing their name come up again and again. They're one of the best institutes where you can learn to give and practice study for your exams and clear them in one shot. They have quite a few dentists who have cleared their exams in one attempt, and they are, very proud of that. Um, it comes at quite a great cost. So let's say if I say I want to start my process, I would like to join Prep Doctors. These are just some approximate numbers from Prep Doctors, Confidentists, DSTC, and there are quite a few of them who are doing this preparation for dentists. For the first part, you're looking at anywhere between $6,000 to $8,000. It does take about 6 to 8 months where they're going to train you. So there's going to be many other professionals with you who are a part of these study groups or these, where you get your study materials. There's a lot of mock tests that they do. Um, everything that you may need for your exam, when the time comes, they would have gone through it. That is the assurance that when you pay this amount, you know that you already have an edge over another dentist who may be great at his studies, who is a very diligent worker. But the fact is that if you don't know how things work over here, it doesn't matter how much information you have, you are not going to have an edge over someone who has done this. Do I recommend any of these? 100%. Just for this reason, because you will have an edge over somebody who has not been able to invest in this. ACJ, 3,500. NDCC, it's 28,500. This is for a 2 year program, which means that you are going to be able to have access to their working stations. You want to, like the steps I told you about amalgam restoration, crown preparation, you are able to do these for up to 8 hours a day. They'll give you their workstation. They'll say, this is your workstation. Please keep prepping teeth as many times as it needs for you to be able to do this as perfectly as is possible. ADAT and bridging. So what these prep doctors or the other have done is that they have something called an ADAT and bridging program. Because when you write your ADAT, of course, you need to know what to study for the ADAT, but followed by that, you also have the interview and the bench exam. Now, as someone who has seen the interview process happen as a third person, it's very different when you are coming from a different country. What kind of questions to expect at the interview, right? Let's say I scored my 720 and I've gotten a call to university. That interview is as important as my ADAT was. If I do not know what kind of questions to expect or what kind of answers I am supposed to be giving over there, I could lose my chance. So it doesn't matter how many hours I give to the ADAT. If I'm not prepared for my interview or for my bench exam, we're back to square one. So for that, they have ADAT and bridging program where they help you prepare for the kind of activities or the exercises you might have to do in the bench exam, as well as the questions you can expect in your interview. Now, meanwhile, this is where I'm going to answer your question. You've come into Canada. You understand that there are some financial institutions that can help you out, but what can you do meanwhile to make your case stronger? Whether I decide to go for the equivalency process or whether I decide to go the other route of university, um, find a way to get into the dental office. Now, how can I get into a dental office? I can apply for a job as a front desk or a dental receptionist. It's a fantastic avenue. Why? Because you get to see the everyday running of a dental office. You get to see the interaction between the patients, the front desk, the patients and the doctor, the dental assistant, right? Insurance is a very big part of dentistry in Canada. That's again something that you get a huge exposure to when you are working at the front desk. The second one is NDAB or the dental assistant. And then finally, we have the dental hygienist. Now, as far as the NDAB is concerned, this is a 2 to 3 part exam. If I am a dentist from a foreign country, I can come over here and I can reach out to NDAB and I can say, okay, these are my credentials. I have done my dentistry. I would like to certify to be an assistant over here. There are two types of dental assistants in Canada, a level or a level two. To be a level one dental assistant, I don't have to have any kind of background in dentistry and I can still get into it. I can reach out to an office that's looking for a dental, a lot of dental offices that are happy to train you from scratch to be a dental assistant, right? And that's what makes you a level one dental assistant. But if I am a level one dental assistant, my pay may be anywhere, or my hourly wage may be anywhere from the least, that is the minimum wage, up to around $20 to $21. Whereas if I am a level two dental assistant, then I am able to start anywhere from $25 and go all the way up to $35 per hour. Of course, $35 is as good as it gets. I would say between 25 to 26 is what you can what you can expect at the beginning. Now, if I am a dentist, I apply to NDAB. I have to write a clinical exam first, a theory exam, and then I can be certified. Now, as far as the exam is concerned, it happens 4 times in the year. So I can choose to take my exam any one of those times. There is, like I said, a clinical exam, a theory exam. Around. Once I give this exam, I am certified level two dentist. If I want to work as a level two dentist and I want to have a job in Ontario, then there is something called a HUB certification. That is, I'm allowed to take X-rays now. Now that HUB certification, again, something like prep doctors is preparing anyone if you can tomorrow get up and say, you know what, I'd like to be HUB certified and work in a dental office. You can go to prep doctors, they can prepare you. They have courses. The exam itself takes $2,000. There was a time between last year, 2025, and 2026 this year, where the government had given some grants and they have given out HARP certifications at no cost to people who could apply and were eligible for it. So these programs are always happening. You have to either have a network or be always on the lookout as to when that happens next, where you don't have to pay anything at all and you're able to get a certification at no cost. Because once you have your HARP certification, there are going to be many more dental offices who are going to be in need of you. And finally, we have the last one, that is the dental hygiene. There are people, internationally trained dentists, who decide that before I can gather my funds and figure things out how I want to be a dentist, I'm going to instead try for a dental hygiene program. Dental hygiene program is an excellent program. Again, it's a competitive exam. If you are a foreign trained dentist, it can take anywhere between 18 to 24 months to get a dental hygienist diploma. Once you do get that, the cost associated is around $40,000 to $60,000 for the 2 year diploma. Once you do start working as a dental hygienist, you can expect a salary of anywhere between $55 an hour all the way to 75, depending on which part of Canada you are in. If you go through the equivalency process, it can take anywhere from 2 to 4 years, depending on how many attempts are being taken. If you go through the college route, it can again take anywhere from 3 to. For something like that, there are more than one attempt to each exam. If you do not pass the exam in one attempt, the idea is that you will give it a second try and you will give it a third try. If it still happens that you find yourself in a position where you've given all the tries and you've not cleared, then that is something that you will have to definitely pay off. And then you'll have to find a different job, which will.
So thank you so much, Ruchi and Peace, for leading this session. Very informative. To find that advocacy body for dentistry to advocate for our international educated dentists so that we can get those persons that are within the profession coming into Canada into practice as much as possible to supporting our population here. I tell you from track record, as it pertains to request for support for assistance from the IEHP-CAN program, we have similar number of dentists and nurses within the program. And so I'm just a little bit taken back. We're not seeing dentists here physically today, but the number of persons that you're seeing requesting services is similar to the amount of nurses that we will have accessing services from us. With that being said, thank you for joining the session. It's